Learning outcomes. Dear students, in the last modules, we studied about depressants and their classifications and also about barbiturates. After studying this module, you shall be able to know about nature, classification and intoxication of alcohol, signs and symptoms of alcohol poisoning, collection and preservation of exhibits in alcohol poisoning cases, extraction, identification and quantification of alcohol in biological matrices. First, introduction. The use or abuse of ethanol is associated frequently with medico-legal implications and consequences. Alcohol abuse is prevalent worldwide. Efforts have been made to totally prohibit alcohol consumption in different countries without much success, with the possible exception of those countries where religious law is in force. Such attempts usually lead to illicit brewing and consumption with even more serious consequences. At present, in India, total prohibition is in force only in the state of Gujarat. Alcohol acts as a depressant of central nervous system and particularly affects the brain. The extent of depression is in proportion to the concentration of alcohol within the body. Forebrain is the area which is prone to the action of alcohol. But as soon as the level of alcohol in blood rises, other parts of the brain also get affected. As ethyl alcohol or ethanol is the most prevalently used form of alcohol that is used for human consumption, so the further usage of the term alcohol would be referred to as ethyl alcohol. Effects of alcohol on body. Effect of alcohol on brain. The physiological and behavioral changes of alcoholic intoxication on various parts of the brain, cerebral cortex. It processes information obtained from various senses, process thoughts and consciousness, initiates the movement of various voluntary muscles. Alcohol affects the cortex in the following ways. It inhibits the proper thought process, thus the judgment and thinking ability of a person gets affected. It depresses the behavioral inhibitory centers. As a consequence, the person becomes more talkative and overconfident. It slows down the processing of information obtained from the senses. The individual feels blurred vision and difficulty in hearing, smelling, touching and tasting. The threshold for pain is also increased. Hippocampus. This region controls the emotions and memory of a person. As an effect of alcoholic intoxication, the person is subjected to exaggerated states of emotion like anger, aggressiveness, etc., coupled with memory loss. Next is cerebellum. It coordinates the muscular movement of the body. As alcohol affects the cerebellum, the muscle movements become uncoordinated. In addition to this, cerebellum also coordinates the fine muscle movements, which plays a crucial role in body balancing. Thus, impairment of this region leads to a stage which is described as falling down drunk. Hypothalamus and pituitary gland. Hypothalamus and pituitary gland coordinate hormones. Alcohol has two noticeable effects on hypothalamus and pituitary gland which influence sexual behavior. Alcohol suppresses the nerve centers in hypothalamus and controls sexual instincts. Thus, the person becomes sexually aggressive and in case of severe intoxication may even commit an offense. Urine excretion. Alcohol inhibits the action of pituitary and thus reduces the production of antidiuretic hormone. When the level of ADH drops, the kidney does not absorb as much water. Consequently, the rate of maturation increases. Medulla. It controls essential body functions like heart rate, Body temperature, breathing and consciousness. As alcohol starts influencing upper centers of medulla, the person starts feeling sleepy and eventually may become unconscious. If the BAC is high enough to influence the outer centers like breathing, heart rate and temperature, the person starts breathing slowly. Body temperature starts falling along with the blood pressure. This may also lead to death. Effect of alcohol on other body parts. In addition to the brain, alcohol also affects other body parts and organs, liver. Alcohol damages the linings of the liver, which is known as alcoholic cirrhosis. The symptoms of cirrhosis of the liver vary with the stage of the illness. In the initial stages, there may not be any symptoms. The chief symptoms are loss of appetite, lack of energy which may be debilitating, a brownish or orange tint to the urine, confusion, disorientation, personality changes, blood in the stool, and edema. Stomach and intestine. Drinking alcohol even a little makes stomach to produce more acid than usual, which can in turn cause gastritis, inflammation of the stomach lining. This triggers pain, vomiting, diarrhea, and in heavy drinkers, even bleeding. Alcohol causes damage to the muscle layer of the stomach and intestinal wall. Use of alcohol can cause decreased gastrointestinal smooth muscle contraction. After chronic use of alcohol, there is an increase in propulsive contractions which causes diarrhea. Muscles. Protein synthesis is essential for muscle growth. Drinking alcohol actually inhibits protein synthesis. Therefore, alcohol stops the muscle growth. Alcoholic cardiomyopathy is a disorder in which drinking too much alcohol over a long period of time weakens the heart muscle so that it cannot pump blood efficiently. Next is skin. Much of the focus of alcohol is centered on the liver, but the skin is left out. The chief effects of alcohol on skin are: alcohol robs nutrients of body including vitamins and antioxidants. Vitamin A specifically helps the body to produce collagen and regenerate new skin cells. Drinking too much alcohol causes the blood vessels in the face to dilate, causing red and spider-like veins to appear. Alcohol dehydrates or depletes the body water and highly oxygenated blood that it needs to keep skin hydrated and moistured, thus leaving the skin dry. Alcohol can cause flare-ups of rosacea, a common skin disorder that produces redness in the nose, chin, and cheeks. It increases the blood flow in the skin so that the face of the person intoxicated looks flushed and such person starts sweating profusely. Next is alcohol intoxication. Alcohol intoxication, which also known as drunkenness or inebriation, is a physiological state that induced by the consumption of alcohol. If the rate of alcohol consumption exceeds the rate at which the alcohol can be metabolized, then the concentration of alcohol in the blood rises to accumulate and the individual becomes intoxicated. First is acute intoxication. Acute intoxication is usually a consequence of deliberate heavy drinking, either small doses at short intervals or a large dose at a time. Alcohol acts as a depressant of central nervous system and particularly affects the brain. The extent of depression is in proportion to the concentration of alcohol within the body. Forebrain is the area which is prone to the action of alcohol, but as soon as the level of alcohol in blood rises, other parts of the brain also get affected. However, the part of the brain that is most resistant to the effect of alcohol is medulla. It is last to fail and regulates the vital functions of the body like heart functions, respiration, etc. Generally, 3 stages are noticed in case of alcohol intoxication. Signs and symptoms. First stages of excitement. In this stage, the person becomes excited with a feeling of well-being and pleasure. The drinker converses well but becomes emotionally very unstable. There is increased self-confidence but a lack of self-control. He may disclose his secrets. In this stage, the blood alcohol level may vary from 0.05 to 0.1%. Next is stage of incoordination. Stage of excitement is followed by the incoordination of thought, speech and action, which are manifested as a state of confusion. It is coupled with impaired judgment, slurred speech and staggered gait. The person becomes so violent that he may commit any crime. Nausea and vomiting are common in this stage. Breath smells of alcohol. Face is flushed and the pulse is rapid. Sense of touch, taste, smell and hearing are diminished. In this stage, the blood alcohol level may vary from 0.1 to 0.3%. Next is stage of narcosis. In this stage, the motor and sensory cells are deeply affected. The patient passes into a deep sleep and responds only to strong stimuli. His pulse becomes rapid, pupils are contracted and the temperature of the body falls below normal. In this stage, the blood alcohol level is 0.3% or above. With recovery, the coma gradually lightens into a deep sleep and the person usually recovers within 8 to 10 hours and finally wakes up with acute depression, nausea, abdominal discomfort, irritability and severe headache. If coma continues for more than 5 hours, the prognosis is likely to be worse. Prolonged coma may cause irreversible hypoxic brain damage and ultimately death. Fatal dose. About 150 to 250 ml of absolute alcohol is generally considered fatal for an adult. About 60 ml of absolute alcohol is considered to be fatal in case of a child below 12 years of age. However, the fatal dose may vary according to the habit and age of patient as well as the nature and strength of the liquor taken. Fatal period. The usual fatal period varies from 12 to 24 hours. Postmortem appearance. On operating the body cavity, the odor of alcohol gets frequently noticed. Acute inflammation of stomach with a coating of mucus is commonly found. The brain, liver and lungs are highly congested and the blood is usually fluid and dark. These symptoms are coupled with edema and congestion of the brain and meninges. Cloudy swellings of parenchymatous organs are often seen. Next is chronic intoxication. Habitual drunkards are either psychotic or neurotic and usually take alcohol as a mean to escape from the stress and strains of life. They have been taking alcohol for a long and continued period. Some develop dysomnia and irresistible desire to take large amounts of alcohol until they become almost unconscious from its effects. As time passes, the habit recurs even at shorter intervals. Mostly there is some psychological basis of some distressing event in the patient's past life responsible for this condition. Signs and symptoms. The patient suffers from nausea, vomiting, anorexia, diarrhea, jaundice, tremors of tongue and hands, loss of memory, insomnia and impaired power of judgment. The symptoms of peripheral neuritis and dementia occur in the last stage. Such patients generally die suddenly from coma. Postmortem appearance. The gastric mucous membrane is deep reddish brown with patches of congestion or effusion. The liver is congested and shows fatty infiltration and the signs of cirrhosis. The kidney shows granular degeneration, whereas the heart is dilated and shows fatty degeneration. Clinical syndromes of chronic alcoholism. 3 common clinical syndromes which result from chronic alcoholism are delirium tremens. It is a state of excitement with hallucinosis which usually lasts for 3 to 4 days. It generally results from an unusual large amount of drinking, sudden withdrawal of alcohol, acute inflammation such as pneumonia or influenza, exposure to cold, and shock from an injury like fracture of a bone. It is characterized by an attack of acute insanity which is manifested by the common symptoms like sleeplessness, marked tremors, excitement, fear, and hallucinations, chiefly visible and occasionally auditory. The person may seek to escape from his situation by committing suicide. He may often become violent to commit a crime. Next is Korsakoff's psychosis. It is a syndrome characterized by disorientations, hallucinations, and multiple neuritis. The patient's memory for the recent events is lost and he starts filling these gaps by confabulation. This state lasts for about from 1 month to 1 year. Next is acute hallucinosis. It is a state of hallucination, chiefly auditory, with systematic delusions of persecution. The stage may last from weeks to months. The patient may become suicidal or homicidal in response of his hallucinations. Next is sample collection. In the cases of suspected deaths due to alcoholic intoxication, viscera is collected and preserved in saturated saline. Special attention must be paid in the preservation of these samples. Otherwise, it would put the whole examination in vain. In cases of suspected intoxication, samples of blood and urine are generally collected. Before the suspect's skin is punctured with a sterile needle, it must be cleaned by the swab of a non-alcoholic disinfectant like aqueous mercuric chloride, aqueous benzalkonium chloride, or Ziparin, etc. The use of an alcoholic disinfectant may either give false positive results or may contribute to falsely high alcohol contents of blood. About 5 to 10 ml of blood sample must be collected in a test tube and must be stored in a refrigerator, usually at 4 degrees Celsius after adding the anticoagulant like EDTA, potassium oxalate, etc. and preservative like sodium fluoride. The addition of anticoagulant will prevent clotting and the preservative will inhibit the growth of microorganisms which are capable of destroying alcohol. The urine sample is also collected in the usual manner and preserved with 30 mg of phenyl mercuric nitrate for every 10 ml of urine. Next is extraction of ethyl alcohol from biological materials. Ethyl alcohol is isolated from biological materials by acid distillation. Viscera, vomit, stomach contents and other materials should be analyzed separately. 50 to 100 grams of viscera finely minced should be brought to the consistency of a thin gruel by adding 3 to 5 times of distilled water and acidify with sulfuric acid and submitted to steam distillation. The flask containing the material should preferably be heated on the water bath. The condenser and the receiving flask should be well cooled with ice, especially in the hot season. The outlet of the condenser being dipped in little water or NaOH solution. A few pieces of pumice stone may be taken in the flask to prevent bumping. It is better to collect the distillate in 4 to 5 fractions, out of which the first one should not exceed 20 ml and the remaining fractions should be 50 ml each. The distillate contains alcohol and other volatile acids, etc. Next is chemical analysis of ethyl alcohol. The following tests are to be carried out for the detection of ethyl alcohol in the exhibits. First is iodoform test. Take 1 ml of the distillate and add a few drops of 10% NaOH to it. This is followed by drop-wise addition till the solution becomes brown. The mixture is warmed on low flame or water bath for few minutes. A few drops of iodine solution are added to change the color of the solution from brown to yellow. The mixture is again heated on low flame or water bath. Yellow color precipitate is formed on standing. The precipitate is observed under the microscope. Characteristic hexagonal crystals of iodoform are seen. Also positive in presence of ethanol, acetaldehyde and isopropanol, which on standing for a long time breaks into flower-like structure as indicated in the picture. Next is sulfur-molybdic acid test. 1 gram of molybdic acid in 25 ml of concentrated sulfuric acid constitutes the reagent. Add 2 ml of hot reagent to 2 ml of distillate. A deep blue ring appears at the junction of 2 liquids. On shaking, whole mixture becomes deep blue. This blue color indicates the presence of ethyl alcohol. This test is very sensitive and is negative with acetone, acetaldehyde and dilute solution of methyl alcohol. Strong solution of methyl alcohol gives only a light blue color after several minutes. Next is ethyl benzoate test. Add 2 drops of benzoyl chloride to 2 ml of distillate. The mixture is made alkaline by adding 10% sodium hydroxide, drop by drop. On warming, irritating smell of benzoyl chloride is replaced by sweet fruity odor of ethyl benzoate. Methyl alcohol also gives this test, but it does not give the iodoform test. Next is determination of ethyl alcohol in blood or urine. In the cases related to drunkenness, detection of alcohol in body becomes very important. However, the best method is to note the behavioral abnormalities of the suspect, but it could only be confirmed by analyzing the breath, blood or urine. The analysis of breath can be performed on the spot with the help of breath analyzer instruments like alco-sensor, breath analyzer, etc. However, the alcohol content of the blood could be determined by using the modified version of Kozilka and Hein-Cavit method. Kozilka and Hein-Cavit method, the basic principle behind this method is that alcohol is easily oxidized to acetic acid in the presence of oxidizing agents like potassium dichromate and sulfuric acid. So each ml of N by 20 potassium dichromate solution that is reduced in this process is equivalent to 0.575 mg of alcohol. Next is Widmark's formula. Widmark has given simple formulas to estimate the amount of alcohol present in body. First is for blood analysis. A is equal to CPR, where A is total amount of alcohol absorbed in the body, P is weight of the person, C is concentration of alcohol in the blood, and R is the constant, namely 0.68 for men and 0.5 in case of women. In case of urine analysis, A is equal to 3 by 4 QPR, where A is total amount of alcohol absorbed in the body, P is weight of the person, Q is concentration of alcohol in urine, and R is the constant, namely 0.68 for men and 0.5 in case of women. Now we shall discuss about the instrumental techniques for the analysis of ethyl alcohol. First is gas chromatography. Numerous methods have been described for the determination of ethanol in whole blood, serum and urine, the most popular being gas chromatography or GC. The operating conditions should be column, Pora-Pak polymer bead 80 to 100 mesh or its equivalent, which can separate or resolve the ethanol. Column temperature should be 160 degrees centigrade. Carrier gas used is nitrogen. Rate of gas flow is 50 ml per minute, and the detector used is flame ionization detector or the FID. Alternative operating conditions, column can be 0.3% Carbovax 20 m on 80-100 mesh Carbopack C, 2m into 2 mm ID or its equivalent, column temperature 35 degrees Celsius for 2 minutes, and then programmed at 5 degrees Celsius per minute to 175 degrees Celsius and hold for at least 8 minutes. Carrier gas, nitrogen at 30 ml per minute. Now we shall end this module with summary. Alcohol affects various centers of brain, namely cerebral cortex, hippocampus, cerebellum, hypothalamus and medulla. In addition to the brain, alcohol also affects other parts and organs of the body like liver, stomach and intestine, muscles and skin. Acute intoxication is usually a consequence of deliberate heavy drinking, either small doses at short intervals or a large dose at a time. Delirium tremens is a state of excitement with hallucinosis which usually lasts for 3 to 4 days, which generally result from sudden withdrawal of alcohol. Korsakoff's psychosis is a syndrome characterized by disorientation, hallucinations and multiple neuritis. About 5 to 10 ml of blood sample must be collected in a test tube and must be stored in a refrigerator, usually at 4 degrees Celsius, after adding the anticoagulant like EDTA and potassium oxalate and preservative like sodium fluoride. The urine sample is also collected in the usual manner and preserved with 30 mg of phenyl mercuric nitrate for every 10 ml of urine. Ethyl alcohol is isolated from biological materials by acid distillation and confirmed by iodoform test, sulfomolybdic acid test and ethyl benzoate test. The concentration of alcohol in blood and urine is determined by Kozilka and Hein-Kevitt method, which could further be confirmed by gas chromatography.